Hello everybody, Dr. John here, wanting to talk to you about a really exciting supplement that we're reviewing this month. And this is the MYOS Muscle Growth Formula for canines. And this is going to be a game changer. I first read the white papers about this incredible new supplement or the finding of something called fortotropin. And fortotropin is the active ingredient in fertilized chicken yolk. And that yolk is pasteurized to protect all those amino acids and the fortotropin and put together in a powder. And this powder is an incredible supplement for helping build muscle in our companions, but also help slowing down or putting the brakes on muscle atrophy that we see as our patients age. Because we know as we get older, our requirements to consume amino acids go up, but also our body's ability to build amino acids go down. So we start to lose muscle. We start to lean out. We get what's called sarcopenia, and that's non-disease related loss of muscle. We've all seen those older, or they look older because they start losing the muscle in their temporal, around their face, around their body. And this is an incredible supplement that has been designed to help slow down that aging process through the process of myostatin. And myostatin is in the blood, and that's what regulates your ability to put on muscle. So as we age, the level of myostatin in the blood goes up, and that puts the brakes on our ability to put on muscle or develop muscle. By lowering the level of myostatin in the blood, we then are allowing the body to then produce muscle. And that's what this incredible supplement does. It allows the dropping of the myostatin levels in the blood and the body's ability now to start to produce muscle. And that's what this is. This really is a game changer. And so I have just completed a 3.5-month study with my own pets and also patients' pets to see how they reacted to this supplement. And can I say it has been astounding. My own pets, my 18-year-old cat, has put on muscle, is now more invigorated, doing activities that she hasn't done for years. Patients are now going and doing activities. There's a Labrador retriever that is now doing walks, swimming in the dams that it hasn't done before. We also saw that they lost body condition score or fat. So as we've transitioned over that 12-week period, we saw that they lost fat, but also put on muscle. And this is generalized overall muscle. So it's helped their vitality. It's helped their general being. I know in my cat, she has a new lease on life because we're building muscle everywhere, not just specifically around injury sites. That traditional medicine thinks about if we have a cranial cruciate ligament tear, we want to protect that cranial cruciate ligament. But this is building muscle. Actually, there's a great paper that came from Kansas State University, and it was a double-blinded study. Here we go. Just make sure I'm saying that right. Kansas State University, and that looked at 100 dogs. And they split them into 50-50 dogs. One was on the supplement of fortotropin, one was on a placebo. They all had TPLO surgery. After surgery, they measured circumference of the thigh muscle, and over the period, the ones on fortotropin didn't lose muscle mass size around the surgical site from disuse atrophy. The ones on the placebo lost muscle mass size due to disuse atrophy. So disuse atrophy is where you're not using the limb because you've just had surgery. We know our canine companions notoriously, if you don't use it, you lose it. And so that is a great way to test because they're not using it, they're going to lose muscle mass. But this study showed that the ones on the 100% fortotropin kept muscle mass, didn't lose muscle. So that way as they're starting to recover from surgery, they've got that muscle mass there to help propel them to a faster recovery and a less, hopefully, complications than if they lose muscle mass, they don't want to use their limb, and so it's a longer recovery road. So this was really fascinating for how we can use this incredible supplement. So it's now been shown it can be used for non-use atrophy. Also sarcopenia, so that's the loss of muscle as we age. Cachexia, that's loss of muscle during disease, so kidney disease, liver disease. This supplement has been shown to help prevent muscle loss with that, but also help put muscle on. Also, this can be used for training or elite athletes, because now we have a supplement we can give them to help build muscle, help them recover faster after injury, help them recover after periods of long exertion, and also help minimize the chance of injury. So I believe this is going to be a real game changer in how we look to treat our beloved pet companions or patients. And I really encourage, if you want to learn more, go to YouTube. I've just completed a 1-hour video that we go into great detail about this, the original, but also the other 3 versions of this incredible supplement, how it can be used, how it works, and also other uses for this supplement. So once again, Dr. John here, just signing off, and look forward to seeing you on the next video.